So next up this evening, we want to welcome Dr. Lillian Smith, Dean of Northern Arizona University's College of Health and Human Services, which operates several of the allied health programs here. So that includes our physician assistants, our occupational therapy, physical therapy, athletic training, and previously, Dean Smith was the department head and professor in the Department of Community and Environmental Health in the College of Health Sciences School of Allied Health at Boise State University. Did you get all of that on a title? It is. So that's good. Though Dean Smith does share. She joins us this evening, and she's going to share us about NAU's own plans to develop their medical school and significantly expand the healthcare programs that are across the state. Welcome, Dean Smith.
Hello. Hi. So I am Lillian Smith. I'm the Dean for the College of Health and Human Services at NAU. That is a little bit smaller, isn't it, than the other titles. So I'm delighted to share with all of you about how NAU is focused on the Arizona healthcare workforce and how we've grown our programming here at Phoenix Bioscience Core and how the PBC serves as a hub for our future growth in healthcare professional programming. So our college, we are located throughout the state. At PBC, we currently have programming in occupational therapy. We have physical therapy, athletic training, physician assistant studies. We also have a new program in North Valley that is in nursing. So we're having a big expansion here, as well as across the state. Our major health initiatives, and especially since expanding here over the last 10 years to PBC, we've really evolved to embrace the vision and mission of elevating excellence, and that's the NAU strategic roadmap. And what that is, we aim to be the nation's preeminent engine of opportunity, vehicle of economic mobility, and driver of social impact by delivering equitable post-secondary value in Arizona and beyond. And we take that seriously in the College of Health and Human Services. We're on a mission. To this end, our NAU leadership has been addressing barriers to access to higher education. And NAU health initiatives are built on this strong institutional foundation. Our NEI funding, the New Economy Initiative, $22 million to provide access and expand the programming in health sciences. About 80% of that was part of our college, okay? So we have the majority of health profession jobs throughout the state require some form of education. And as Chairman Duvall was talking about, when we talk about economic transformation, people to be able to get these jobs need a little bit of education to be able to get into them. And then to grow takes more and then more. So now, while we've had the huge NEI piece, we have NAU Health. And with NAU Health, it's our response to the Arizona Board of Regents, our Arizona Healthy Tomorrow. And through this, we have Dr. Janina Johnson, who is the founding dean of our College of Nursing. We're taking our School of Nursing into a College of Nursing. And then we will also have Dr. Julie Baldwin, who will work on the creation of a College of Medicine. And for more information on NAU Health and on the College of Medicine, we have a QR code there for you. You can find out more about that. I'm not going to share a lot about the College of Medicine. A lot of that's still under wraps and still in development. But what we have done is we have increased access to educational opportunities. We have more seats in our programs, and we have the ability to train more Arizonans and allow them to get into these careers, to work within systems that provide insurance, that provide retirement, to have opportunities for people to work in an area and actually maybe get employer tuition benefits once we can get them through the door in first-level jobs. And so we want our folks to be able to participate in our economy to build generational wealth. So at the PBC, we offer these graduate-level health programs. Currently, we have 450 students there, and to date, we've graduated over 1,000 health professionals in the 10 years that we've been here. All of our graduate programs, we have higher than average national certification exam pass rates, and the majority of our students stay here in Arizona and in rural underserved areas. In some of our programs, our PA program to be specific, over 80%. So through NEI, we've already done expansions of our programs. We've created more seats. We have in occupational therapy, we've expanded seats in our existing programming, and we've launched a new weekend program. So we can serve people who are already working and can come to the university over the weekend to get additional training. Physical therapy, we are increasing our residential cohort at both PBC and in Flagstaff. And we have a new exciting hybrid DPT that was just approved by our accreditors, and it will be a competency-based educational model. It'll be one of the first competency-based educational models in the US. And then also in PA studies, we've increased our residential cohort, so we've expanded across the board. But we also have a new graduate certificate and a Doctor of Medical Science, which will be the first Doctor of Medical Science for PA offered by a state university here in Arizona, and will include 24 credit online post-professional doctorate. And it launches in 3 weeks. So you may have noticed, as you will hear from us, there's a lot for the incumbent worker, for people that are already working in the field. We want to give them an opportunity to be able to come back and to continue to grow and expand their careers. So, if we'll go on, there we go. NAU health expansion. So through NAU health expansion, what are we doing with that? So we have a lot of expanded programming, but how are we actually preparing people to be in those seats? How are we preparing people to be in these graduate level programs throughout the state? And that's where a lot of our NAU health programming now will be coming in. And I'm so pleased to announce that we have received funding, internal funding, from our provost and president. Thank you, Dr. Pugliese, to start a new community health and interprofessional development program. And with this particular piece, what we're doing, we're going to be building capacity to train entry-level staff to provide clinical placement experiences. We need to build that capacity because while we can have more seats, do we have more capacity to actually take clinical placements out in rural underserved areas? And the answer to that would be no. How are we doing that? And those are the things that we'll be looking to address. We'll be integrating interprofessional education and practice throughout our curriculum. And while IPE is big, and it's big at all of our universities, what we're doing is we're actually creating a health science core that will start in their freshman year of college. So we'll have a health science core that prepares our students all the way through their undergraduate programming into their graduate and doctoral programming. Okay? Because we need to be preparing students regardless of whether or not they get into our wonderful College of Nursing or whether or not they get into one of our medical science programs. If they don't get into those very specific cohort programs, how are we preparing them to be in health and wellness and to be able to be working in our communities? And so we want to do this all the way through. We're also looking at pathway development, so we're looking from K to 12. How are we actually helping our K through 12 navigate into the health sciences? And one of the ways we'll be doing this is also, so after K through 12, we have people that are out there working, and for example, they may be doing community health worker type work, community health representatives out on our reservations. These are career technical education certificate type programs. How are we aligning ourselves so that we can make sure that these people who are trained, working in our communities, and committed to working in rural, underserved communities have the opportunity to grow their career and go on? And that leads to my last program that I get to talk about. It is our postgraduate fellowship for PAs and NPs, for physician assistants and for nurse practitioners. And why I'm really excited about this program is that we'll be able to place NPs and PAs, again, in rural, underserved areas. So they'll be in a fellowship program, but they will also serve as a conduit for practical placement, for clinical placement. And we will be purchasing a piece of their time to actually serve as mentors, okay? So that way we can have people that are in a CHW program. CHWs take 480 observational and or paid hours to get certified. 480 hours. If you're in an overworked, overwhelmed clinic, do you have time, right, to be able to actually mentor and guide these young people? So by being able to build capacity there in the clinics themselves, then we have an opportunity to be training and creating opportunity for those people in our community settings. So we are very excited about all of this. If you would like more information, we'll be having, actually, I think on the 22nd of January, we will be doing a visioning session here in Phoenix, and really encourage you, if you're interested in finding out more about our CHW and our fellowship program, please contact me at that email. Thank you.